This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Did you know that drinking water at the wrong times can actually worsen blood sugar spikes in seniors? Many older adults with diabetes are unknowingly making critical hydration mistakes that directly affect their glucose control. Today, I am going to explain exactly how and when seniors should drink water to support their blood sugar levels and overall diabetes health. As a doctor, I see countless seniors struggling with blood sugar management, and one of the most overlooked factors is proper hydration. Water is not just about quenching thirst. It plays a fundamental role in how your body processes glucose, maintains insulin sensitivity, and manages diabetes complications. Let me start by explaining why water matters so much for blood sugar control in older adults. When you are dehydrated, your blood becomes more concentrated. This means the glucose in your bloodstream becomes more concentrated as well, leading to higher blood sugar readings. For seniors with diabetes, even mild dehydration can cause significant spikes in glucose levels. Your kidneys are responsible for filtering excess glucose from your blood and eliminating it through urine. But when you are not drinking enough water, your kidneys cannot function efficiently. They need adequate fluid to flush out that excess sugar. Without enough water, glucose stays in your bloodstream longer, making it harder to maintain stable blood sugar levels. Research shows that chronic, mild dehydration is extremely common in older adults. As we age, our sense of thirst diminishes. Many seniors simply do not feel thirsty even when their bodies desperately need fluids. This is particularly dangerous for those managing diabetes because they may not realize they are dehydrated until their blood sugar is already elevated. Another important factor is that high blood sugar itself causes increased urination. When glucose levels rise above a certain threshold, your kidneys try to eliminate the excess through urine. This creates a cycle where high blood sugar leads to fluid loss, which then concentrates the blood further and raises glucose even more. Breaking this cycle requires strategic water intake. Let me explain the specific times when seniors with diabetes should prioritize drinking water. First thing in the morning is absolutely critical. After 6 to 8 hours of sleep without any fluid intake, your body is naturally dehydrated. Your blood is more concentrated, and your glucose levels may be elevated. Drinking 1 to 2 glasses of water immediately upon waking helps dilute your blood and supports better fasting glucose readings. Before meals is another crucial timing. Drinking water about 20 to 30 minutes before eating serves multiple purposes. It helps with digestion, creates a sense of fullness which can prevent overeating, and prepares your body to process the incoming glucose from food more effectively. Studies suggest that pre-meal hydration can improve post-meal blood sugar control in people with diabetes. However, I need to caution you about drinking large amounts of water during meals. While staying hydrated is important, consuming too much liquid while eating can dilute your digestive enzymes and stomach acid. This may slow down digestion and potentially affect how your body absorbs nutrients and processes carbohydrates. A small glass of water with your meal is fine, but avoid drinking excessively during eating. After physical activity is when your body needs water replacement most urgently. Exercise depletes fluids through sweat, and for seniors with diabetes, this fluid loss can quickly impact blood sugar levels. Even moderate activities like walking or gardening require hydration replenishment. Make it a habit to drink water within 30 minutes after any physical exertion. Now let me address how much water seniors with diabetes should actually drink. The common advice of 8 glasses per day is a general guideline, but individual needs vary significantly. Factors like your weight, activity level, medications, climate, and diabetes control all influence your hydration requirements. A more personalized approach is to calculate based on body weight. A reasonable target for most seniors is approximately 30 milliliters of water per kilogram of body weight daily. For someone weighing 70 kilograms, this would be around 2,100 milliliters, or roughly 8 to 9 cups throughout the day. However, you should discuss your specific needs with your healthcare provider. Pay attention to your urine color as a hydration indicator. Pale yellow urine generally suggests good hydration, while dark yellow or amber-colored urine indicates you need more fluids. For seniors managing diabetes, monitoring urine color is a simple yet effective way to assess hydration status throughout the day. Let me explain some common mistakes seniors make with water intake. Drinking too much water too quickly is problematic. Your kidneys can only process a certain amount of fluid per hour. Consuming large volumes rapidly can overwhelm your system and may even dilute important electrolytes like sodium and potassium, which are crucial for people with diabetes. Instead, spread your water intake evenly throughout the day. Think of it as maintaining a steady state of hydration rather than trying to catch up all at once. Set reminders if necessary. Many of my senior patients find it helpful to fill a large water bottle in the morning and track their progress throughout the day. Another mistake is relying on thirst as your only hydration cue. As I mentioned earlier, the thirst mechanism weakens with age. By the time you feel thirsty, you may already be mildly dehydrated. This is especially true for seniors with diabetes, who may have reduced thirst sensation due to nerve damage or medications. Drink water on a schedule, not just when you feel thirsty. Some seniors avoid drinking water because frequent urination is inconvenient, especially at night. This is understandable, but limiting fluids to avoid bathroom trips can be dangerous for diabetes management. A better approach is to consume most of your daily water intake during daytime hours and reduce intake 2 to 3 hours before bedtime. This maintains hydration without disrupting sleep. Let me discuss the relationship between certain diabetes medications and hydration. Some diabetes drugs, particularly SGLT2 inhibitors, work by causing your kidneys to eliminate more glucose through urine. These medications increase fluid loss, making adequate water intake even more critical. If you are taking these medications, you may need to increase your baseline water consumption. Diuretics, commonly prescribed for high blood pressure in seniors, also increase urine output and fluid loss. If you take diuretics along with diabetes medications, your hydration needs are significantly higher. Work with your doctor to determine the appropriate fluid intake that balances your medication effects with proper hydration. Temperature and climate dramatically affect hydration needs. Seniors living in hot climates or during summer months lose more fluid through perspiration. Even in air-conditioned environments, older adults may not adequately replace lost fluids. During warm weather, increase your water intake by an additional 2 to 3 glasses daily. Now, let me address what counts as hydrating fluids and what does not. Plain water is always the best choice for hydration. It has no calories, no sugar, and no additives that could affect blood glucose. For seniors with diabetes, water should be your primary beverage throughout the day. Herbal teas without added sugar can also contribute to hydration. Options like chamomile, peppermint, or ginger tea provide fluids without impacting blood sugar. However, be mindful of caffeine-containing teas, as excessive caffeine can have a mild diuretic effect and may interfere with hydration if consumed in large amounts. What you should avoid are sugary drinks, fruit juices, and sodas. These beverages cause rapid blood sugar spikes and provide empty calories that make diabetes management much harder. Even natural fruit juices, while they contain vitamins, are concentrated sources of sugar that can destabilize glucose levels in seniors with diabetes. Diet sodas and artificially sweetened beverages are controversial. While they do not directly raise blood sugar, some research suggests artificial sweeteners may affect insulin sensitivity and gut bacteria in ways that could indirectly impact glucose metabolism. My recommendation is to limit these drinks and focus primarily on plain water for hydration. Coffee deserves special mention. Moderate coffee consumption, defined as 2 to 3 cups daily, appears safe for most people with diabetes and does contribute to overall fluid intake. However, coffee does have a mild diuretic effect, so it should not replace water as your main hydration source. Also, avoid adding sugar or high-fat creamers that can affect blood glucose and weight. Let me explain how to recognize dehydration signs specifically in seniors. Common symptoms include dry mouth, fatigue, dizziness, confusion, dark urine, decreased skin elasticity, and rapid heartbeat. For someone with diabetes, dehydration can also manifest as persistently high blood sugar readings that do not respond well to medication. Confusion and cognitive changes are particularly important warning signs in older adults. Dehydration affects brain function, and in seniors, even mild fluid deficits can cause memory problems, difficulty concentrating, or disorientation. If you notice these symptoms alongside elevated blood sugar, inadequate hydration may be a contributing factor. Skin turgor, or skin elasticity, decreases with age anyway, but severe dehydration makes it worse. You can test this by gently pinching the skin on the back of your hand. If it takes more than 2 seconds to return to normal, this may indicate dehydration. Combine this observation with other symptoms for a more complete picture. Now let me discuss the connection between hydration and diabetic kidney disease. Many seniors with long-standing diabetes develop some degree of kidney impairment. Proper hydration is crucial for protecting kidney function, but it becomes more complicated when kidneys are already damaged. If you have early-stage kidney disease, maintaining good hydration helps your kidneys filter waste products more efficiently and may slow disease progression. However, in advanced kidney disease, fluid retention becomes a concern, and drinking too much water can be harmful. This is why personalized medical advice is essential for seniors with diabetes and kidney problems. Regular monitoring of kidney function through blood tests that measure creatinine and estimated glomerular filtration rate helps your doctor determine appropriate fluid intake. If your kidney function is declining, your healthcare provider may adjust your daily water recommendations and monitor you more closely for signs of fluid overload. Let me address hydration during illness. When seniors with diabetes experience infections, fever, vomiting, or diarrhea, fluid needs increase dramatically. Illness-induced dehydration can cause dangerous blood sugar fluctuations and increase the risk of diabetic ketoacidosis or hyperosmolar hyperglycemic state, both serious complications. During sick days, you need to drink even more water than usual, even if you do not feel like it. Small, frequent sips are often better tolerated than large amounts at once. If you cannot keep fluids down due to vomiting or severe diarrhea, contact your healthcare provider immediately, as you may need intravenous fluids. Monitoring your blood sugar more frequently during illness is critical. Dehydration combined with infection or stress can cause blood glucose to spike unpredictably. Check your levels every 2 to 4 hours when sick, and follow your sick day management plan that you should have discussed with your doctor. Let me explain the relationship between hydration and blood pressure in seniors with diabetes. Many older adults deal with both diabetes and hypertension. Adequate hydration helps maintain healthy blood pressure by ensuring proper blood volume. When you are dehydrated, your blood volume decreases, which can actually cause blood pressure to drop too low in some seniors, leading to dizziness and falls. Conversely, chronic dehydration can sometimes contribute to higher blood pressure because your body releases hormones that constrict blood vessels to maintain blood flow despite reduced fluid volume. This creates additional strain on your cardiovascular system. Proper hydration helps regulate these mechanisms and supports more stable blood pressure. For seniors taking multiple medications for diabetes, blood pressure, and other conditions, medication interactions with hydration status can be complex. Some medications work better when you are well hydrated, while others require monitoring if your fluid intake changes significantly. Keep your doctor informed about your hydration habits so they can optimize your medication regimen. Let me discuss practical strategies to help seniors remember to drink enough water. Visual reminders work well. Place water bottles or glasses in locations you frequent throughout the day, like next to your favorite chair, on your bedside table, or in your kitchen. Seeing water readily available serves as a prompt to drink. Technology can help too. Smartphone apps can send hydration reminders at scheduled intervals. If you are not comfortable with apps, simple timers or alarms on your phone or watch can work just as well. Set reminders every 2 hours during waking hours to drink a glass of water. Pairing water intake with routine activities creates automatic habits. Drink a glass of water after taking your morning medications, before each meal, after using the bathroom, or after checking your blood sugar. Linking hydration to existing habits makes it easier to maintain consistency without relying solely on memory. Flavor enhancements can make water more appealing if you find plain water boring. Adding slices of cucumber, lemon, lime, or fresh berries can provide subtle flavor without adding sugar or calories. Herbal infusions like mint leaves also make water more interesting while keeping it diabetes-friendly. Some seniors benefit from keeping a hydration journal. Record how much water you drink each day along with your blood sugar readings. Over time, you may notice patterns showing how better hydration correlates with improved glucose control. This tangible evidence can be motivating and helps you fine-tune your intake. Let me address concerns about water quality. Tap water quality varies by location, and some seniors worry about contaminants. Using a water filter can improve taste and remove potential impurities. However, avoid relying exclusively on bottled water, which can be expensive and environmentally problematic. A quality home filtration system is usually a better long-term solution. The temperature of water you drink matters less than you might think. Some people prefer cold water, others prefer room temperature. Cold water may be more refreshing and might slightly boost metabolism, but the difference is minimal. Drink water at whatever temperature you find most palatable, as this encourages you to drink more consistently. Now let me explain how hydration affects wound healing in seniors with diabetes. Adequate water intake is essential for tissue repair. Diabetes already impairs wound healing due to reduced blood flow and immune function. Dehydration further compromises healing by reducing blood volume and nutrient delivery to damaged tissues. Seniors with diabetic foot ulcers or other wounds must prioritize hydration as part of their wound care regimen. Proper fluid intake supports the formation of new tissue, helps deliver immune cells to fight infection, and maintains skin integrity to prevent new wounds from developing. Let me discuss the role of electrolytes alongside water intake. While plain water is crucial, your body also needs electrolytes like sodium, potassium, and magnesium to function properly. These minerals help regulate fluid balance, nerve function, and muscle contractions. For most seniors eating a balanced diet, food provides adequate electrolytes. However, if you are sweating heavily, experiencing diarrhea or vomiting, or taking diuretics, you may need electrolyte replacement along with water. Sports drinks can provide electrolytes, but often contain high amounts of sugar that are inappropriate for diabetes management. Better options include low-sugar electrolyte solutions specifically designed for people with diabetes. Coconut water is sometimes suggested as a natural electrolyte source, but it contains significant natural sugars. While healthier than sugary sports drinks, it should be consumed in moderation and accounted for in your carbohydrate intake if you have diabetes. Plain water with a pinch of salt and a squeeze of lemon can be a simple homemade electrolyte solution. Let me address hydration for seniors with diabetes who exercise regularly. Physical activity is crucial for blood sugar management, but it increases fluid needs. Before exercise, drink about 1 to 2 cups of water. During prolonged activity lasting over 30 minutes, sip water every 15 to 20 minutes. After exercise, drink enough to replace what you lost through sweat. Weigh yourself before and after exercise to estimate fluid loss. For every pound lost during activity, drink about 16 ounces of water to rehydrate properly. This is particularly important for seniors, as older adults may not feel as thirsty after exercise, even when significantly dehydrated. Morning exercise requires special attention to hydration. If you exercise first thing in the morning, you are already starting from a dehydrated state after overnight sleep. Drink at least 1 glass of water before beginning your workout, and continue hydrating throughout your activity. Let me explain how seasonal changes affect hydration needs for seniors with diabetes. Winter dehydration is often overlooked. Indoor heating systems dry the air, and you lose moisture through breathing in dry environments. Additionally, cold weather reduces thirst sensation even more than aging alone does. Maintain your water intake during winter even though you may not feel as thirsty. Summer presents obvious hydration challenges with heat and increased sweating. Air conditioning can also be dehydrating. During hot months, seniors with diabetes should increase water intake proactively, not waiting for thirst. Keep water easily accessible wherever you spend time, whether indoors or outdoors. Humidity levels also matter. High humidity impairs your body's ability to cool itself through sweating, which can lead to overheating and increased fluid needs. In humid climates, pay extra attention to hydration and watch for signs of heat-related illness combined with blood sugar fluctuations. Let me discuss the impact of hydration on diabetes-related complications beyond kidney disease. Diabetic neuropathy, or nerve damage, affects many seniors with long-standing diabetes. While hydration cannot reverse nerve damage, adequate fluid intake supports overall nerve health and may reduce symptom severity by maintaining good blood flow to nerve tissues. Diabetic retinopathy, affecting the eyes, also benefits from proper hydration. Good fluid balance helps maintain normal eye pressure and supports the delicate blood vessels in your retina. While hydration alone cannot prevent retinopathy, it is one component of comprehensive diabetes care that protects your vision. Cardiovascular health in seniors with diabetes depends partly on hydration status. Proper fluid intake helps maintain blood viscosity, reducing the risk of blood clots and supporting healthy circulation. Dehydration makes blood thicker and more likely to clot, increasing risks for heart attack and stroke, which are already elevated in people with diabetes. Let me address hydration considerations for seniors using insulin or other injectable diabetes medications. Injection site health can be affected by hydration status. Well-hydrated skin is more resilient and heals better after repeated injections. Dehydration may contribute to injection site irritation, bruising, or poor insulin absorption. Proper hydration also affects how predictably insulin works in your body. Blood flow and tissue fluid levels influence insulin absorption rates. Significant dehydration can alter insulin absorption, making blood sugar control less predictable. Maintaining consistent hydration helps keep insulin action more stable and reliable. For seniors using insulin pumps or continuous glucose monitors, skin health around device sites is crucial. Adequate hydration supports skin integrity and may reduce complications like site infections or adhesive irritation. Drink enough water to keep your skin healthy and resilient under these devices. Let me explain hydration strategies for seniors with diabetes who have limited mobility. If getting up frequently to refill water is challenging, prepare several filled water bottles or a large pitcher within easy reach at the beginning of each day. Use bottles with measurements so you can track intake without needing to count separate glasses. Insulated containers keep water cold and appealing throughout the day without requiring trips to the refrigerator. For seniors with arthritis or grip strength issues, choose bottles with easy open caps or use cups with handles that are easier to grasp securely. If frequent urination due to increased water intake is limiting mobility or causing falls risk, focus on drinking more during morning and afternoon hours when you are most active. Reduce intake in the evening to minimize nighttime bathroom trips while still meeting daily hydration goals. Now, let me discuss when to seek medical attention related to hydration and diabetes. Severe dehydration is a medical emergency. Warning signs include extreme thirst, very dark urine or no urine output, rapid heartbeat, rapid breathing, confusion, sunken eyes, and blood sugar readings persistently above 300 milligrams per deciliter despite medication. If you experience these symptoms, especially combined with nausea, vomiting, or abdominal pain, you may be developing diabetic ketoacidosis or hyperosmolar hyperglycemic state. These are life-threatening complications requiring immediate emergency care. Do not try to manage severe dehydration at home. Call emergency services or go to the hospital immediately. Less urgent but still important, contact your healthcare provider if you notice consistent difficulty maintaining hydration despite efforts, unexplained weight loss, persistent fatigue, or blood sugar levels that seem harder to control than usual. These could indicate underlying issues requiring medical evaluation and treatment adjustment. Let me summarize the key principles of hydration for seniors with diabetes. Drink water consistently throughout the day rather than large amounts at once. Prioritize morning hydration, pre-meal timing, and post-exercise replenishment. Use urine color and body weight as monitoring tools for adequate intake. Avoid sugary beverages and limit artificial sweeteners. Make water readily available and use reminders if needed to maintain consistent intake. Adjust fluid consumption based on activity level, climate, illness, and medications. Work with your healthcare provider to determine your individual hydration needs, especially if you have kidney disease or take multiple medications. Remember that proper hydration is not just about drinking enough water. It is about strategic timing, understanding your individual needs, and recognizing how hydration directly impacts your blood sugar control and overall diabetes management. The connection between water intake and blood sugar stability is clear and well established. For seniors managing diabetes, optimal hydration is one of the simplest yet most powerful tools available. It costs nothing, has no side effects when done correctly, and provides benefits that extend far beyond glucose control to your entire body. Make hydration a priority every single day. Your kidneys, your blood sugar, your heart, and your overall health will thank you. Small, consistent efforts with water intake can lead to meaningful improvements in how you feel and how well you manage your diabetes. So if you like this video, please like and subscribe for more videos like this.